So for my benchmark and final video, my topic was cervical neck pain. So for my background, there's a girl named Anna. She's a senior at Grand Canyon University. She's been having some complications with her neck while she's on a club softball team for GCU. She's also a dedicated nursing student. With having this major, she spends a lot of time at her desk studying and doing homework. She's having a lot of trouble staying focused with her schoolwork when she is having constant pain in her neck. So we did a manual muscle testing, we did anterolateral neck flexor assessment, and both right and left she got a 1, which is the lowest she can get. And then posterior lateral neck extension, she also got a 1 on her right and her left, which is also the lowest you can get. And then the anterior neck flexor assessment, she got a 3, which is the best. Next, we did a gait assessment to kind of observe her neck. But so for feet, knees, LPs, HC are all normal and good. They all looked fine. And then once we got to the shoulder, they were rounded a little bit forward. The overactive muscles were her pecs and her lats, and her underactive would be her mid and lower trap and her rotator cuff. And then we also noticed her head was pronated forward while doing this, which means her overactive muscles were her upper traps, and her underactive muscles were her deep cervical flexors. Next, we did a static posture assessment. And then, so for the anterior checkpoint, everything looked basically good. Everything was level. And we also did a posterior, and it was the same thing with that. It was when we got to lateral posture assessment, we saw some complications. Her shoulders were rounded forward. They weren't straight. And then her head also had excessive extension forward. And then some potential causes of these findings is prolonged forward head lean at her desk from studying from all these hours for the past 4 years in college. So this just means her overactive muscles are over her upper traps and her levator scapulae and her pectoralis. Her underactive muscles are deep neck flexors, lower traps, and serratus anterior and rhomboids. So for our first step, we did an inhibitory phase. The inhibitory purpose is to decrease overactivity of neuromuscular tissue. The primary technique is self-myofascial release. Self-myofascial releases are to alleviate the side effects of active or latent trigger points. So we did SMR. The muscles we wanted to focus on was the thoracic spine, the levator scapulae, and the upper trap. Whenever doing this exercise, you want to hold it for 30 seconds on the tender area. And the exercise we chose was the thoracic spine with the roller. So for our first exercise for the inhibitory part of the CEC, we're going to do a thoracic roller with the spine. So what we're going to do is you're going to reach it back from here, and you're going to move like so, like that. Okay. You want to make sure when you're holding the tender spot, you're holding it for 30 seconds. And this is going to help with your upper trap. Good. So for the next step, we did a lengthening. The lengthening purpose is to elongate of mechanically shortened muscles and connective tissue necessary to increase range of motion at the tissue. We did static stretching, and the muscles that we wanted to focus on was also the upper trap. This was going to be a 30-second hold, and the stretch was called the upper trapezius stretch. For the second one, it's going to be a lengthening phase, and we're going to do a stretch. You're going to go like this, you're going to grab this on your head, you're going to pull it towards you, and then switch after that. And this is also going to help with your upper trap, and it's also helping with your lengthening your neck muscles. And you want to hold each side for 30 seconds. Okay, good to switch. Good job. For our third phase, we did the activation stage. The purpose of this is it refers to the stimulation or re-education of underactive myofascial tissue. It is a comprehensive exercise strategy and must also address the underactive tissue. So it's considered isolated strengthening, and the muscles we want to focus on here is the deep cervical flexors, cervical erector spinae, and lower traps. with these exercises, you usually want to do around 10 to 15 reps and with a 2-second isometric hold and a 4-second eccentric contraction. And we're going to focus on the lower traps as well. And the exercise we did was called a Superman. So for our third exercise, it's going to be our activation exercise, and we're going to be doing Supermans. This is going to help activate your lower trap. So for each one, it's going to be like this. You move this, you go up, and then slowly back down. That's right. So you want to go up, and then you're going to hold it for 2 seconds. And then on the way down, you want it 4 seconds slowly on the way down. And you want to do this for 10 to 15 reps. For our last step, it's the integrated technique, and the purpose of this is to retrain the collective synergist functions of all muscles through functional progression. So it's just a step up from the strengthening stage. So for this one, we did a ball combo with a cervical retraction. We want to make it more of a dynamic movement. We want to do it 10 to 15 reps, but under control. So for our last one, we're going to do a ball combo with a cervical retraction. So what you're going to do is you're going to come up, you're going to layer this, and then you're just going to go straight up. And make sure you're pinching and activating the middle and lower of your back. Make sure you're just pinching it backwards. You want to do this for 10 to 15 reps. Good job. Make sure you feel that activation in your lower back, in your neck muscles as well. Good job. So that is it for my video. Thank you for watching.